Hey, I'm going to be talking about ADHD. So, what is ADHD? First off, ADHD is attention deficit hyperactive disorder, and that is a condition that makes it harder for children or kids or even adults to pay attention or control their behavior. There are three types of ADHD. And inattention is when a person wanders off task, lacks persistency, and has difficulty sustaining focus or being disorganized. Uh, the next one is hyperactivity, and that is when a person has to move constantly, including in situations in which it is not appropriate, or excessively fidgeting, taps, or talking. The next one is impulsive, and that is when a person makes actions that occur in the moment without first thinking about what they're doing and having high potential for harm in those types of situations or people around them, or a desire for immediate rewards or inability to delay gratification. ADHD obviously gets in the way of learning and um, completing tasks, so you can't absorb information or get your work done if you're running around the classroom or your job or wherever, and you start to zone out in what you're supposed to be doing, like reading or listening to what people are saying to you. What causes ADHD? So some theories, people aren't really for sure how ADHD is, or what the cause of it is, but some theories are genes, things that you're doing while you're pregnant, like smoking, using drugs, drinking alcohol, exposure to toxins in the environment, or brain injuries, things like that. So um, I found that preschoolers are the most common to have the ADHD, and the symptom for that is the most common for them is hyperactivity, and these behaviors include like I said before, inattention, motor activity, impulsivity. They're more severe. They occur more often and interfere with school, um, jobs, your social life, things like that. And it's also more common in males and females. And females with ADHD are more likely to have problems, primarily with inattention. Other conditions such as learning disabilities, conduct disorder, depression, um, these are common for people with ADHD. Some treatments for ADHD would be so under medication, supervision, stimulants medications are considered safe for those who use them. However, there are risks and side effects, especially when misused or taken in excess of the prescribed anxiety, or for the prescribed dose. Sorry. For example, stimulants can raise blood pressure and high rate and increase anxiety. Therefore, a person with other health problems like high blood pressure, heart disease, seizures, um, should tell their doctor before taking these stimulants. A few other ADHD medications are non-stimulants. These medications take longer to start working than stimulants, but can also improve focus, attention, and impulsivity in a person with ADHD. Doctors may subscribe or prescribe a non-stimulant when a person has uh, bothersome side effects from the stimulants, um, or ineffective, or in a combination with the stimulant to increase effectiveness. Another form of treatment would be psychotherapy, and a type of psychotherapy would be behavioral therapy, which aims to help a person change his or her behavior. It might involve practical assistance, such as help organizing tasks for completing schoolwork or working through emotional difficult times or events. Another form of psychotherapy is family and marital therapy, and that helps family members and spouses find better ways to handle or cope with the disruptive behaviors, to encourage behavior changes and improve the interaction with the patient. How many are being served in the US? So the percent of children estimated to have ADHD has changed over time, and its measurements can vary. The American Psychiatric Association states in the Diagnostic and Statistical Manual or Mental Disorders that 5% of children have ADHD. And other studies in the US have estimated higher rates in community samples. But right now, I guess in 2016, 6.1 million kids between the ages of 2 and 17 years old have been diagnosed with ADHD. And this is just a graph showing the increase in recent years of the estimated number of children who have had ADHD. So you can see that it's differed. Obviously, like I said, it's varied. There's no specific reason why, but like I said earlier, it might be because of what the mom is doing while she's pregnant, or the toxins in the air, or maybe even what you eat. It just kind of depends on what's going on with the body, pretty much. Do students demonstrate the same characteristics? No, they don't, because not everyone is the same. So obviously they're not all going to have the same behaviors or characteristics. Students with ADHD were categorized under the category of other health impairments, but was not identified as a distinct category of its own. So there's that. Effective class-wide interventions. So there's classroom interventions for the student with ADHD should be based upon solid foundations of general behavior intervention principles. So there's also some instructional considerations like task duration, peer tutoring, scheduling, organizing. So these would be task duration, accommodate to the student's short attention span. Academic assignments should be brief and feedback regarding accuracy immediately. So larger projects should be broken up into different parts so the students can comprehend what they're actually doing and what they're actually learning. Direct instruction is attention to task is improved when the student with ADHD is engaged in teacher direct as opposed to independent seat work. So this should really be like a one-on-one type thing with them, and both comprehension and on-task behavior improve with the development of these skills. Peer tutoring. Class-wide peer tutoring provides many of the instructional variables known to be important in setting up students with ADHD for success. So, for example, it provides frequent and immediate feedback. So, kind of like the task duration, you want immediate feedback. Do these types of interventions for them. And then there's way more. These are just the ones I picked out. Distractions. General research has not supported the effectiveness of complete elimination of all irrelevant stimuli from the student's environment. So, however, as these students have difficulty paying attention to begin with, it is important that attractive alternatives to the task at hand be minimalized. So activity centers, mobiles, aquariums, things that actually get their attention and that they're interested in, try doing that. And it'll should not be placed within the student's visual field. So there's thank you for listening to my PowerPoint about ADHD, and that is all I have for you. Here are my sources, and hope you learned lots like I did. Thank you.